Hello, good morning. Good morning. How are you doing? Happy Sunday to every one of you. Good morning. Good morning. Please indicate where you are watching from, if you don't mind. How are you guys doing? How are you guys doing? You're welcome. Happy Sunday. Please indicate where you're watching from. I'm waiting for, let's get about 10 minutes. Let's see if everybody is going to be online. How are you guys doing? Let's see what is going on. All right. Hello, how are you guys doing? Happy Sunday. Happy Sunday to every one of you. Let's see. Let's wait for about 5 minutes, 10 minutes. I just let everybody join the program and then we'll start. Meanwhile, if you have any question, feel free to send your question. If you have any question to ask before we start, feel free to ask your question, please. Mhm. How are you? Juma J, how are you doing? How are you doing, Juma J? All right. Okay. We shall be discussing this morning, this afternoon, or evening, depending on your location, about diabetics and amputation. All have to do about have to do with your diabetics foot. So we're going to talk about ulcerations, and then knowing the risk factors and how to prevent amputation if you have diabetics. Okay. So we're going to look at the common factors. Okay. Understanding the linkage, why you must do everything possible to avoid having amputations if you have diabetics. So what to know about diabetics and amputations, they are all intertwined. Okay. Diabetes can also lead you to have an amputations if you have uncontrolled diabetics for a longer period of time. So we're going to be discussing that in details. All right. Juma J, how are you? Dr. Place, what medication can we use for? It says, Place, what medication can we use for nerve damage and the circulation issue? Juma, there is no, when it comes to neuropathy, when it comes to neuropathy, nerve damages, okay, blood circulations, there is no cure for it. There is no cure for it. And I've told you guys before why nerve damages have no permanent cure, because it's as a result of diabetics. The only way you can have a cure of nerve damage is to have a cure for diabetics. Once you cure diabetics, then it takes care of all these other complications. So nerve damages have no cure. Are there medications? There are medications that you can use to relieve. When I say relieve, it's a temporary relief. Those pains and burning sensations. There are medications out there. There are thousands of medications that can relieve you those pain or those burning sensations, but it is not permanent. Okay, so at the end of the day, it's going to relieve it temporarily. But once your sugar level creeps up again, once you have too much carbs, or if you eat food that contains too much carbohydrate, and your sugar level shoot up again, those nerve damages, nerve pain, those symptoms are going to come back again. So, so there are no permanent medications to say, if I take this medication now, it's going to stop those nerve damages. No. Once your nerves are damaged, it cannot be recovered. Those damages are damaged forever. So all you have to do is to protect the remaining ones. The only way you can protect those nerves that are not damaged is to control your diabetes. That's all you have to do, is to control your diabetes, control your sugar level, and then it's going to save your nerves. But if you're not controlling your sugar level, it's going to now cause you to have those peripheral neuropathy, those nerve damages, those symptoms of body sensation, tingling. There are medications to temporarily relieve you those pain. They are going to give you painkiller. If you go, most of the doctors are going to give you painkiller. If you have all those body sensations, they're going to give you painkiller, all those things, that contains ibuprofen. Okay, but it's a temporary relief. It doesn't cure it permanently. Okay, the only way is to control your sugar level. Chimbo, you're welcome. Okay, so the only way is to control your sugar level at all times to avoid the complications of nerve damages. Now, you have to, Juma J, you're talking about medications and then the circulation. That is what we are going to discuss. So you have to be patient a little bit when we go to that area. Okay, when we go to those areas, okay, so when we go to those areas, we'll talk about it. But as I said, the only way you can you can prevent this circulation issue or nerve damage is to control your diabetics, control your sugar level. The other medications that are out there are for temporary relief. Okay, but once your sugar level goes up again, those things come back again. The only way to cure this peripheral nerve damages is to have a cure for diabetics, because this nerve is as a result of diabetes. So once diabetes has no cure, You cannot cure it. But there are medications, and most medication they are going to give you is painkillers. Okay, it's painkillers. That's what they're going to give you. Okay. So, so as I was saying, Juma, all right. Okay. Juma, do you understand what I'm trying to say? Hello, Diane. You're welcome. All right. For instance, um, let's look at this. Hold on. Let's look at this. What I'm trying to let's go to. Juma, okay, you see, this is one of the these medications, okay, but it's a temporary relief for treating of nerve damage, okay, but it's for a temporary relief. It does not cure it, okay. It does not cure it. It's gonna, Neka, you're welcome. So this is one medication for treating nerve damage. It does not cure it. It's only going to relieve it. Okay, so I can give you guys a lot, but at the end of the day, it does not cure it. The only way for you to have control of those nerve damages is to control your sugar level. The next medication I'm going to share with you guys is this one. Okay, uh, you know, so this is the next one. They are all used in treating nerve damages, but it's for temporary relief. Okay. Uh, Mazwakin, how are you? Okay, so all these medications are for temporary relief. The only way is to control your sugar level. Okay, the only way is to control your sugar level. I'm going to share one more. This is the next one. Acetaminophen. Okay, paracetamol is a non. This is the next one. To most doctors, they are going to give you pain relieving. To treat all those nerve damages. Okay, so um, let's okay. This is the next one. Okay. So these are some of the medication. There are a lot of them. Okay. There are a lot of them in treating nerve pains. Okay. Panadol, paracetamol, Tylenol. Okay. Beverly, you're welcome. All right. So these are some of the medications. There are thousands and thousands of them. All right. There are thousands and thousands of them to use. Neka is early today. Well, okay. Diane, you are welcome. So as I was saying, okay, as I was saying, these are some of the medications. There are a lot. We have opioids. They can, we have those things. All right. We have lidocaine. Okay, they can give you lidocaines. Also, pregabalin. There is a medication called pregabalin, lidocaine, dilozepine, opioids, capsaicin, the one I just mentioned to you guys now. All those medications are used in treating nerve pain, but as I said, they are just for temporary relief. The only best way to avoid nerve damage is controlling your sugar level at all times. It has no cure because it has related due to diabetes. The only way to get rid of nerve pain is to get a cure for diabetes. Once you get cure diabetes, it takes care of all those complications. Since we cannot cure diabetes, you cannot cure neuropathy. So they can give you a medication just to temporarily relieve it. But what happens if you go and eat too much again, too much carbohydrate, and your sugar level goes up again? Those burning sensation comes back again. That means you have to, and it is not good for you to depend on painkiller all the time. Once your sugar level goes up and start having those body sensations, you go to taking painkiller. You have to avoid taking too much of painkiller. It is not good for you. All right. So the best way is to control your sugar level. Now, in terms of, and again, those nerves, when those nerves are completely damaged, okay, once those nerves are completely damaged, it cannot be recovered. All you have to do is to do the ones that are not damaged, you have to protect it to make sure those ones are not damaged. But any nerve that have been damaged, that is it. You've lost it forever. The ones that are still alive is the one that you can still keep to make sure you protect it. And by doing that, you have to control your sugar level from henceforth. All right. Now, in terms of the blood circulation, because you also mentioned something about blood circulations, it has all those things have to do with the nerves, the arteries, and the blood vessels. Once your sugar level is too much and damages the blood vessels, you can't recover those blood vessels. Those part of the areas are dead. That is why once your nerves, your blood vessels, your arteries in those areas are dead, you can't have any feeling. Okay, because blood is not circulating in those areas. Okay, so you can go to a surgery. You can go to a surgery, okay, and you have to be very careful because I lost a friend that went to a surgery to open up the artery so that blood can reach in those fluids, but they couldn't do it properly. They could not do it properly because blood is not flowing in those areas. So he went for a surgery to repair it a little bit, to remove those dead nerves, and then those ones the little ones that are still alive to get it straightened out. But they could not do it properly. So he started experiencing blood clot in those areas, and then he came to the office. I saw him. We chatted. We went for a dinner. And we went for a lunch. Okay. I saw him. He came to my office. We talked, gossip a little bit, what is happening in Africa, in Nigeria. And then went for a lunch. All right. And then in the evening, we're supposed to have a discussion over the phone. So he got home around 5 p.m., finished taking his shower, finished eating. By 9 p.m., he's dead. Okay. While I was waiting for him to call me the same night, by 9 p.m., the same day, he's dead. So he went upstairs. The wife were downstairs. They don't even know that the man had already died for almost an hour upstairs. So he went and collapsed. And then when the wife go upstairs, he saw his husband on the floor, blood coming out from his mouth. He's already dead because there are blood clots. They couldn't do the surgery properly. So the blood clot in those areas. So the blood clot, forced the arteries in the heart to burst up. Okay, the blood clot forced the arteries in the heart to burst up, and then he gave up. So that is why it's not advisable to go for surgery when your nerves are completely dead, except you get a specialist. Even most of the time, the chances of getting it right is slim. So that is why you have to make sure the best way is to control your sugar level at all times. That's the only best way to do it. All right. So now let's go back to our topic. Okay. Let's go back to what I'm supposed to discuss this morning. Now, on this, you say why I don't like prescribing medications on this page is that I don't want these things that I just shared here is I'm not prescribing them to you. Okay, I have to also make sure, warn you guys, I'm not prescribing it to you because I'm not your doctor and I'm not you're not my patient. I'm only sharing an information to you. Why I don't like sharing medications here. Like the way I share it now, people are going to go and buy it without even consulting their doctor, and they start taking it. So this is just for educational purpose. That's why I share the medications is for educational purpose. If you have to use it, please go back to your doctor and get an approval from your doctor if you can use these medications. Maybe your doctor might have a better one than the one I just shared. There are thousands of them. There are thousands and thousands of them for relieving nerve pains. Okay, paracetamol, Panadol, you can buy them in chemists. Like a lidocaine, there are some lidocaine, they are the ones that you cannot see. But please and please, this one that I share, if you have to use it, go back to your family doctor to get an approval. Maybe he might have something that is better than the one I just shared. So that is why I hardly share medications on here, because I know people are going to abuse it. As I said, I'm not your personal doctor, you're not my patient, so I don't have your head data to say this is good for you. I'm only sharing for educational purpose. So that's a warning to you, those that are going to see those medications. If you have to use it, please refer to your doctor for approval. Okay, or he or she might recommend something that is better than what I just shared. So I'm sending a warning to all of you there. All right. Now, so what do you understand with amputation and diabetics? Let's kick in. What do you have to understand with amputation and diabetics? I want to know who is still here. Is Chimbo still here? Is Beverly? If you are still watching, I want you to confirm. I want to see those who are still here. I want to know those who are still watching and those who just announce their presence and disappear. If you are still watching, can you confirm on the comment section? I want to know who and who that is still here. I want to know who and who that is still here. Nega says she's still here, but I'm doubting that she's still here. I'm doubting if she's still here. All right. I'm surprised it's only Nega that is still here. I don't know. Please, if those that are sending me a question on WhatsApp, I'm live. If you want me to answer your question, please bring it online. I'm live now. I'm not going to answer your question if you're sending it to WhatsApp now. I'm not going to answer them. I'm live, so I don't know why you prefer sending me questions on WhatsApp while I'm live. Can you come to the live session and ask your question? So if you're sending me a question on WhatsApp, it's not going to be answered. All right? Okay. Now let's go to diabetics and amputation. All right. We know that diabetes can cause you to have nerve damage and then circulation issue. Why? Once your nerves are damaged, once the arteries are damaged or the blood vessels are damaged, you're going to have problem with circulations. Blood is not going to be circulating properly in those areas of your foot. That is one thing you have to understand. Now, your nerve damages as a result of your diabetes. If you're not controlling your sugar level, you're going to have an issue with nerve damages. It's a complication of diabetes. Now, to avoid this complication of diabetes, you have to take control of your sugar level at all times. In some cases, this can make a foot or lower leg amputations if you do not control your sugar level as necessary. However, effective treatment can also help to prevent these complications. And what are those treatments? Is those medications I just listed. There are thousands and thousands of nerve pain medications. But one thing you have to understand, it does not cure nerve pain. Nerve pain has no cure at all. It can only relieve the pain temporarily and then comes back again once your sugar level creeps up again. So it's just for a temporary relief to solve those discomfort that you're going through. Now, once you have once you start having those symptoms of nerve damage, those burning sensation, tingling and numbness, that is when you're experiencing nerve damage. And I've explained to you guys when you start experiencing those nerve damages, when you have excess glucose level floating in your bloodstreams, that is when it becomes harmful to your health, because there shouldn't be any excess glucose floating in your bloodstream. Rather, it's supposed to enter the cells of your body and then you can use them as energy. But once your cells are not accessing those excess glucose and then they are floating in your bloodstreams, that is when those damages are occur, attacking your organs and causing you health issues. So reduced blood flow to the feet means that people with diabetes have a higher risk of developing a wound. Okay, and that is why I've emphasized several times that make sure you avoid wound at all costs. Anything blisters cause, blisters, any cut, any foot ulcers, avoid them at all costs once you're diabetics. Or any sore in this part of your body. If a person has a neuropathy and loss of feelings in the foot, they may be less likely to notice mild or leg ulcers due to nerve damages. You're not having any feeling sensations in your foot. Normally, you see, for instance, when the weather is too cold, the first area you notice that the weather is too cold is in your feet. Okay, you see your feet is going to become cold and you start looking for socks to wear. If it's too hot, you can also feel it in your feet. If you are not feeling any temperature changes in your feet, you know something is wrong with you, with your foot. And that is why I say it is important as a diabetes to make sure you check your foot all times. When checking your foot all times, you also have to make sure that you can feel your hands touching your foot. Okay, when you hit your foot, your toes, make sure you are feeling it, because you might be hitting it and you're not feeling it. You can even use a hammer and hit your leg. You can feel the pain. It means those nerves in those areas are completely dead. There is no circulation in those areas. So even if you have a foot ulcer or any wound, you will not even notice that you have a wound in those areas because you're not having any feeling. And then that is how infection gets in. All right. So due to circulation issues, particularly peripheral artery diseases, okay, this ulcer may not heal properly. And I've said this to you several times. Due to your diabetic status, if your sugar level is constantly high, there's no healing. If you have a wound and your sugar level is high, there will be no healing. Healing will start taking place when your sugar level normalizes. Okay, so that is why I've said several times, avoid wounds at all times. Avoid wounds at all times. This can lead to infection, tissue death, and potential lower limb loss. Because once there's a penetration of infection through those wounds, okay, and then I don't know if you guys, I've shared a video with you guys and I've tried to educate you guys how infection penetrates. There are some videos that I share with you guys. There are videos. Let me see if I can get the picture back again. Just a minute. I did a video. I did a video with you guys and I shared I'm going to share the I don't like looking at it. I'm going to get a picture back again and share with you guys so that you know how it works. All right. Let's see if I can see that. If I can see that picture again. If I will see that picture. I know I shared the picture with you guys. That is why I cannot walk in. That is why I cannot walk in the hospital wound healing in the emergency area. If you are not used to seeing wounds, okay. I shared a picture with you guys. I'm trying to get that picture back so that I can use it so that you guys can understand what I'm trying. I'm finding that picture. I didn't know where I put it. All right, I'm not seeing that picture. I wish I can see that picture to share with you guys. Just all right. I'm trying to get a picture of. All right. As I was trying to say, I couldn't find that picture, but if I see it, how infection, the process of infection, I did share the picture. I did a video about it, but I couldn't see it now. If I wish I could see it, I would have been able to. I've been able to use it and let you guys know how infection. As I said, infection does not go. This is parallel. When you get an infection, okay. When you have an infection, food ulcer infection. Let me remove this. Okay, I got it now. I got it. I got it. All right, I got a picture now. So I'm going to share with you guys. All right. I got a picture. I'm going to use it. Okay, can I share? Okay, let me see if I can share the screen and then I will explain to you guys. Okay. All right. You see this food ulcer here? Okay, I'm using this image. You see this food ulcer? That's why I say. That's why I told you guys. Make sure you put a mirror under your foot. Okay, or ask somebody to look under your foot to see if there's any food ulcer. Food ulcer start with like a small, tiny blood. Is a dot. You start like a dot, red dot underneath your foot, and that is how it start getting expand. So underneath your foot is going to be like a red tiny dot. You got to keep an eye on it. Once your sugar level is rising too much, okay. Once your sugar level is rising too much and you're not controlling it, it's going to start like a red dot underneath your foot and then keep expanding. So if you see this picture now here, okay, underneath your foot, that's foot ulcer. Now, when there's an infection, you see, this is your skin, okay, and at the bottom is where your nerves and the bone, the nerves are in contact with your bone. the nerves are in contact with your bone. So when there's an infection from the top of your skin, it has to go through layers. You could see that it is going down to get to the bottom where the nerves are. It is not going vertical this way. It is not spreading this way. As long as the wound remains on top of your skin, you can treat it and stop it and avoid amputation. Okay? Once the wound still remains on this layer without touching the bone here and the nerves, you can still treat it and then heal it and avoid amputation because it is not in contact with the nerves yet. So that is why when you see people with diabetes in the hospital, you see they will have this wound. Their foot is swollen for a year, 2 years, and they are treating it. But as long as it touches the bone, you see, they'll say, okay, you need an amputation immediately to save your life because they cannot hold it anymore. So as long as the wound is still on the top of the skin here, all you have to do is to control your sugar level and then let the healing process start. Because at this stage, it is not touching the nerves. It is not touching the bone. And there's no way it can spread to treating your life. But once you could see that when there's an infection, it goes down this way. It is going down this way to get in contact with your nerves and the bone. And if you fail to treat it whilst in this area, and you allow this infection to go down and touch these nerves here, that is when it spread like a wildfire. That is when it starts spreading like a wildfire, and your survival, you might not even live up to 1 month and you pass on. And that is why as soon as that infection touches the bone, the doctor called for an amputation immediately to save your life because they cannot hold it anymore. Because every minute it's spreading like a wildfire because it's not in contact with the nerves and the blood and the blood vessels. With those infections, they can penetrate the blood vessels, penetrate the nerves, and then spread like a wildfire that's going to kill you. So as soon as it touches the bone, that is when doctors say now you have to amputate. So they look for the section where the infection starts and stop. Okay, so they look in your foot. Say for instance, this is your foot now, and then the infection has penetrated through your foot and touched the bone. So they will look where the infection has spread and where it is safe, and then they'll cut that area out and leave the other area that is not yet infected. So the more you leave it, immediately it touches the nerves, the more you leave it, it is spreading like a wildfire. And if you don't amputate immediately, then you can't live for long. So this is how foot ulcer starts. So it starts like a small dot, red dot underneath your foot. So you have to keep an eye. You got to keep an eye. Once you see something like this underneath your foot, you got to start immediately. The only way to avoid further opening of this wound is to start controlling your sugar level. Then the healing is going to start. But as long as your sugar level still remains high, okay, remains high, it's going to expand, and then open up like a wound. Then infection is not going to penetrate. Okay, so that is the picture I was looking at. Now let me remove this. I'm going to look for another picture. I'm going to look for another picture. I'm sure this is just okay. There's no picture, so I'm going to remove this. I hope you guys understand what I just said now. So I'm going to stop sharing. So let's go back to you guys have any question? So let's go back to what we are discussing about diabetes and amputation. So that is how infection gets to your bone and start infecting. And because one, the nerves are damaged, the arteries are not working, there's no circulation in those areas, you're not feeling anything in those areas, there will be no healing because of the high concentration of sugar levels in your bloodstreams. So at all costs, you have to control your sugar level. Now, how common is it? How common is amputation? Okay, how common is amputation? Diabetes is a significant cause of lower limb loss. Okay, most people, apart from accident, diabetes has a significant increase in amputation. Mostly lack of knowledge how to treat it or how to handle diabetes. Most of these things is lack of knowledge. Because if you understand what diabetes is all about, you can avoid all these complications and the limb loss, all these amputations. So diabetes is a severe cause of lower limb loss, because people tend to forget that. You know what, it's just a sugar issue, so let me just avoid taking sugar in my tea or anything, but that is not it. So even though you are avoiding sugar, you stop taking sugar, but most of the food you eat contains carbohydrate. That carbohydrate is also a glucose also. So it's all about knowledge. Once you understand it, that this is what diabetes is all about. These are the complications that might arise from it if I fail to control it. And understand that it has no cure, but you can live with it. Because many people think that diabetes can be cured. Because of their selfishness, they go and buy something from the street or from the herbalist, and they say, oh, you know what, take this in for 1 month, you're going to be cured. No, it has no cure. Rather, you are causing more harm to yourself. It's lack of knowledge. And once you understand those knowledge about diabetes, it makes life easy for you to understand the complications, the side effects, and how to live and manage it. All right. So how common is diabetes? People with amputation, it is very, very high in people with diabetes. Amputation is very, very high. Okay. About 60 to 80% of food ulcers can heal if you take your medications or treatment very seriously. 60 to 80% of food ulcers can be healed. That is why I say once the wound start opening and it still remains on top of the skins, you can still heal it. But once it touches goes down, penetrate and goes down and touches the bone and the nerves, that is when you're going to be calling for amputations. Now, 10 to 15% of it remain active. Okay, 10 to 15% of it remain active. That is, the wounds remain on, it's not healing, it's just there. You can't heal it. There's no sign of healing. It remains active for a longer period of time. Now, 5 to 24% eventually lead to an amputation. 5 to 25% of it eventually lead to an amputation. So you can see that 60 to 80% of it, people with foot ulcer can be healed. Those wounds can be healed if you understand and know how to lower your sugar level and keep it steady at all costs. Then you can heal it. Now, do you have any question? I see everybody is quiet. Juma, are you still here? Diana, are you still here? Chembo, are you still here? Who is? Let me see who is here. So let's look at let's look at the warning signs. Let's look at the warning signs. All right, let's look at the warning signs of let me see who is there. Okay, so let's look at the warning signs. What are the warning signs that might lead you that you might be needing amputations? Okay. Once you have these warning signs, it is necessary to see your doctor, okay, for a better idea. Because people living with diabetes should pay extra attention to their feet. Your feet is very important. I've told you guys, pay attention to your feet. Especially if you have diabetes, pay attention to your feet. This is because they have an increased risk of wounds not healing, which could lead to need of amputations. All right, your foot is very important. Check your foot every time, every day. Okay, don't just look. And I said to you guys, when you're checking your foot, put in between your toes. Put your hands in between your toes, feel it, to make sure there are no wounds, there are no cut in between. All right, there's no sores, there's no blisters in between. Put a mirror underneath your foot to make sure there's no foot ulcer wound underneath it. Also, make sure you heat it. Use something to heat your toes, your head, to make sure you can feel the touch. All right. Now, some of these signs and symptoms that a person should look out for and contact their doctor, you know, if you are worried about this wound not healing on time. And I said to you guys several times, once your sugar level is too high, there will be no healing. Healing is going to start to take place once you normalize your sugar level to be in its target range. If you have persistent sugar levels too high, there will be no healing. Your white blood cells are down, your defenses are down, so there will be no healing. So you have to improve your white blood cells and your defense is to reduce your sugar level constantly, not just today. No, it has to be constantly for that healing to take place. So what are the warning signs to look out for? Okay, what are the warning signs to look out for? One is swelling in the feet. When your feet start swelling. Okay, what are the warning? We're talking about the warning signs now. So we're discussing about the warning signs. And I say one is swelling in the feet. Once you start noticing swell, your feet are getting, abnormal. You notice swelling in your feet, then you say cause for you to worry and then see your doctor. Number two is blisters. When you start seeing blisters in your foot, all of a sudden you start noticing blisters in your foot, then you have to be very careful. See your doctor about it. Then if you have ingrown toenails, ingrown toenails, you know what we mean by ingrown toenails. All right. That's another warning signs. Then we have the plantar warts. Plantar warts. Plantar warts is another warning sign. All right. Open sores. When you have an open sores, is another warning signs. Athletic foot. Athletic foot is another warning signs. An ulcer that lasts longer than a week. If you have a foot ulcer that lasts longer than a week, is another warning signs. Pain. Okay, pain is another warning signs. All right. Now, let me see if it's gonna work. Let me see. We're discussing about the warning signs. Let me see if this is gonna work. Let me see if this is gonna work. I'm trying to put it's a lot, so I'm trying to see how I can put it. All right, these are the warning signs. Okay. These are the warning signs. So there are about 15 in there. So you guys, so those are the warning signs. There are about 15 in there. So, as I said, swelling in the feet, blisters, ingrown toenails. We have the plantars, the plantar warts. We have the open sores. We have the athletic foot. Okay. We have the athletic foot. We have an ulcer that lasts more than 1 week. We have the pain, active bleeding, skin discoloration, warmth in the area of the foot. We're talking about temperature changes, a deep ulcer where the bone is visible, a bad odor coming from the wound. When your wound starts smelling, your wound starts smelling. ulcer larger than a 3/4 of an inch, when your ulcer now keep expanding, getting big. Okay. Okay. Then a sore that does not quickly begin to heal. These are the warning signs of amputations. These are the warning signs of amputations. All right. Let me see, what did these guys say? Yvonne, Marilyn, you're welcome. Ruth, you're welcome. So these are all the warning signs of foot amputations. So if you have any wound in your feet at the moment, or any blisters in your feet, you got to keep an eye on it. And as I said, for a healing to take place, for a healing to start taking place, you must control your sugar level. Once your sugar levels are high, you won't be able to get that wound to heal properly. And the more the wound is open, the possibility of an infection. And once there's an infection, you start a high risk of an amputation. Okay, so that is why it is necessary to make sure you check your foot at all times. Now, as I was saying before, in the picture that I just shared, okay, in the picture that I just shared with you guys before, when you notice, for instance, I'm going to bring that picture back again. I'm going to bring that picture back again. Let me share that screen again. All right. This, you see, this foot ulcer. A foot ulcer starts with a tiny dot underneath your feet. It's going to be like a tiny dot, like a blood red, brownish something underneath your foot. It is not, the wound is not yet open, but you could see a tiny, you could see the color, you could see a color of that, you see how the color is? It's going to be so tiny. So once you notice it underneath your foot, you got to keep an eye on it. That's a foot ulcer. That's how it starts. It starts with a dot, a small dot, and then keep expanding. Keep expanding, and then the wound is going to open and then start penetrating. And I've showed you guys, these are the level of your skin. As long as the wound remains at the top of your skin here, you stand 60 to 80% of this foot ulcer to be healed properly by controlling your sugar level first. As long as it's within this top of your skin, you can stand 60 to 80% of chance to get it healed and avoid amputation. But you can see that the wound, this infection here, is not spreading this way. Rather, it is going down because it wants to get to the bottom of the bone where the nerves, you see, all these are nerves, blood vessels, arteries connecting to the bone. Once this infection gets into and get in contact with your bone and the nerves, you're going to be amputated, because that is how the infection spread like a wildfire. As long as the infection is at the top of the skin here, it cannot spread. You can still heal it. You stand 60 to 80% chance of getting healed and avoid amputation because it's still at the top of the skin. But once it crosses all these layers and get to where the nerves and the blood vessels and the bone is, it spread like a wildfire immediately. And that is when doctor is going to say, we need an amputation. So they will scan it again, do an MRI scan to see how far the infection has spread and cut that area that has spread and save the area that has not been infected. Because the more you leave it, the more the infection is spreading like a wildfire through the blood vessels and your nerves. And that is how you lose your life. So once it gets in contact with your nerves here, you are 99% to get an amputation. But once it remains at the top here, you stand 60 to 80% chance of getting it healed and avoid amputation. Okay, that is how diabetics works. Now I'm going to look for okay. You see this wound here. I'm using pictures here to buttress my point. You see how it opens. Okay, you see how this wound. Yeah, you see how it opens. You see how it opens here, and that's how it penetrates. It penetrates. This a foot ulcer. That's how it penetrates. That you will now start looking for an amputation. Okay, so you have to. Let me look for another picture here. I'm trying to see a better picture. I'm trying to see a better picture. You can see this one here. You could see how all this ulcer here, okay, see how it opens. So all this is how you have to avoid all these wounds. Okay, when the peripheral artery disease is called peripheral artery disease, when they penetrate through those nerves and get in contact with your bone, you're likely to get amputated. So that is why I'm trying to pass the warning. Okay, let's remove it. So now these are the warning signs. I've shared with you guys the warning signs of the warning signs. All right. Now, what are the risk factors? Okay, what are the risk factors? If any of these symptoms are present, a person should contact their doctors to determine the course of action. It is very important when you start noticing these warning signs to see your doctor immediately. It's important that a person examine their feet regularly. I've said to you, you have to examine your feet regularly. Now, let's talk about the risk factors. What are the risk factors and how to avoid amputations? I've discussed it. How to avoid amputation is controlling. If you're diabetics, have it at the back of your mind, at the back of your brain, that you must control your sugar level at all times. Okay, control your sugar level at all times. It is important you control your sugar level at all times. Now, there are several things a person can do to help prevent a need for a limb amputation. Two particular areas are to focus on a blood sugar maintenance and food care. Maintaining your sugar level is necessary, very important, is key to avoid amputation. Once you make sure that the sugar level is constant at all times, people don't think that, okay, I mean by controlling your sugar level just for a day, for a week, and it's okay. No, it has to be constant. You must make sure you keep your sugar level within the target range every minute, every day, every month, every year to avoid this amputation. And again, food care is very important. I've told you guys it is necessary to check your feet all the time. Feel it, touch it, rub it to make sure there are no only open wounds in your feet. Especially, you make sure that you can feel a touch. Once you are not feeling anything in those areas, it means the nerves are completely dead. There's no circulation in those areas. Then you are at the mercy of any wound. If there's any blisters in those areas, then you're in a very serious situation because there is no blood flow in those areas. There's no any immune in those areas. Okay, so food care and then controlling your sugar level are two risk factors that you must attain at all times to avoid these complications. So when we talk about maintaining, your blood sugar maintenance, it's all about what you eat. Are you exercising? Are you reducing your weight? Are you counting your carbs? All these are necessary. Okay, so blood sugar maintenance. Okay, several lifestyle factors can help a person manage their blood sugar levels, including reducing their stress. Follow a balanced diet meal. I've told you guys, balanced diet is very important. Doing regular exercises, taking your medications, and maintaining a consistent meal and snack schedules. All right, these are very, very necessary in having a blood sugar maintenance. Now, limiting sugary food and drinks. Okay, checking their blood glucose level all the times and reaching or maintaining a weight and blood pressure that is healthy for them. Your blood pressure also has to be good. Your cholesterol pressure is good. The cholesterol level also have to be good. All these things have to match. That is the way you do your blood sugar maintenance. It is important you reduce your stress, follow a balanced diet meal that that has been advised by your doctor or dietitians, doing regular exercises, taking your medication as prescribed, or taking your insulin as advised by your doctor, and then maintaining a consistent meal and snack schedules, limiting your sugary food and drinks, and also reaching or maintaining a weight, blood pressure, and cholesterol levels that are good at all times, and at the same time checking your blood sugar levels at all times. These are key in blood sugar maintenance. Then when we come to food care, okay, I've told you guys about your food care. Checking your food is necessary. Okay, checking your food is necessary. Let me see, Alex. I've been off this program while I apologize. Alex, you're welcome. All right, now so when we talk about food care, all right, another important this food care is a preventative measure. The earlier, the better. You have to learn how to be preventative proactive in certain things. Don't. That's why they say prevention is better than cure. You either prevent it. Don't wait until you get to the stage of cure. Then you start fighting for your life. Make sure you apply preventative measures at all times, and that is why I say foot care is important. All right. Examining the feet regularly or for cuts, bruises, blisters, and scraps are important. Wiggling the foot frequently to stimulate blood flow. When you say wiggling the foot, let's, for instance, this is my foot. You just wiggling it. Okay. When we are sitting in your couch, just wiggle your foot, twist your toes. Okay. That is going to help to improve blood flow. Even your leg. Okay. Your legs, starting from your nails, move your leg, squat, all those things aid blood flow in those areas. Okay. A little bit of massage in your legs, in your feet, all those things aid blood flows. Okay. Now, having another person to examine areas of the foot that are harder to see, like underneath your foot is harder to see. So if you don't have anybody that can help you, put a mirror on the floor, put your foot underneath it, put your foot on top of it. You can see underneath your foot to see if there's any blisters underneath your foot. Now, wearing dry socks. Okay, wearing dry socks, washing the feet daily. Make sure when you go to take a shower, you wash your feet properly. Some people don't wash their feet properly. They just go there, take their shower, and then even their hands haven't even touched their foot. They just go and take their shower and they're out. You must wash your feet daily, cleanly. Then regularly checking that the feet can feel cold and warm temperature. When your feet is not feeling those temperature changes, there's a problem. Now, carefully trimming the toenails. Okay, as I said to you guys, if you're diabetics, don't use razor. Use a clipper to make sure when you are clipping your toenails, you don't cut your skin, because infection can penetrate through those areas. Okay, quit smoking. If you're a smoker and you're battling diabetes, you have to quit smoking. You can't serve two masters at the same time. If you're diabetes and you are smoking, you have to give up one. It's either you give up smoking to fight for diabetes, or you leave diabetes and continue taking your smoke. You cannot serve two masters at the same time. Now, avoid walking around barefoot. Okay, avoid walking around barefoot. Make sure you wear foot like slippers or any other thing. And then schedule regular foot examinations. Okay, schedule regular foot examination. These are all foot cares that are necessary to be on a preventative measure. Okay, these are certain things that you have to do at all times to make sure that you avoid that complication of the amputations, especially if you're diabetics. Let's see, Brian, you're welcome. If you are maintaining a healthy lifestyle and exercise regularly, how often should you be checking your sugar levels? You got to be checking your sugar level as the way you have been doing it before. Living a healthy lifestyle and you're exercising does not mean, okay, since I'm living a healthy lifestyle, I'm exercising now, so I don't need to check my sugar level frequently. No, you still have to check your sugar level frequently. Okay, everything remains the same. You have to check your sugar level before exercise and after exercise. All right. Even though you are living a healthy lifestyle, you're eating a healthy lifestyle, you still have to check your sugar level regularly. So there is nothing like, okay, I'm living a healthy lifestyle, I'm exercising regularly, so I don't need to check my sugar level. You have to check your sugar level regularly and then note it down. For instance, checking your sugar level regularly is part and parcel of your life as a diabetic. Which word am I going to use? Yeah, I see your question twice a day, once a day, or 2 times a day. That's what I'm trying to answer you. Okay. If you are living a healthy lifestyle, if you are exercising regularly, does not change the way you monitor your sugar level. It does not change. You still have to monitor your sugar level. Your sugar level is like a compass. You know, an aeroplane uses a compass. When an aeroplane flag goes up, it uses a compass to know where it is going. That compass is going to direct them to the final destination. Without a compass, the plane cannot know where they are going. They just be wandering on the air. They use that compass is their eye to where they are going. Okay. Now, as a diabetics, monitoring of your sugar level is your guidance. Because, if, for instance, like where I am now, I cannot tell what my sugar level. The only way I can know what my sugar level is when I test it. It's going to tell me, okay, this is what your sugar level is all about. So you have to continue checking your sugar level. Now, in terms of how many times you check it a day, depends on you. The times you check it a day, a week, or a month depends on individual. And why I say depends on individual is the status of your diabetics. The severity of your diabetics will depend how many times you check it a day, or a week, or a month. There are people that their diabetes is very serious. Their sugar level is uncontrollable. Or there are people that are battling type 1 diabetes that their sugar level is fluctuating all the time. Okay, all the time. Then you see, you go to check your sugar level constantly, maybe every 15 minutes, every 20 minutes, you check your sugar level because your status of your diabetes is severe. Your sugar level cannot be controlled. It's uncontrollable. Or you are type 1 diabetes that the sugar level is fluctuating all the time. You have to be checking your sugar level every 20 minutes. Now, if you are the type that your diabetes is controlled, you know what you are doing, okay, you are living healthy, you are not falling sick all the time. Okay, you don't fall sick all the time, you are okay. Then instead of you checking your sugar level every 30 minutes, you can check it every 1 hour. Every 1 hour. So everything depends on individual. You have to set how often you check your sugar level depends on your status. So if you are healthy, okay, if you are healthy, you are living a lifestyle, you are exercising, then you cannot be checking your sugar level frequently as somebody who is not exercising, who is not living healthy lifestyle. So if you are the type that exercise all the time, you live healthy, you won't be checking your sugar level every 30 minutes. You can be checking your sugar level every 1 hour, you check your sugar level, or every 2 hours, you check your sugar level, because it depends on individual. Those that are seriously sick will check their sugar level every 30 minutes, every 15 minutes because of the status of their diabetes and because of other underlying illnesses. So it varies from individual to individual. There is no one rule that says every diabetic must check their sugar level. Either you are sick, either you are eating healthy or not, check your sugar level every 30 minutes. There's no one rule. It depends on individual. Okay, Brian? So you have to look at your situation. Are you reducing your weight? Are you healthy? Do you have any underlying illnesses to set your timetable? To say, okay, I'm going to check my sugar level every 45 minutes. Okay, every 45 minutes, I'm going to check my sugar level. Every 1 hour, I'm going to check my sugar, or every 30 minutes, I'm going to check my sugar level. So everything depends on you. Like those that have the CGM, okay, those that have the CGM, somebody asked me about CGM last time, the continuous monitoring system. Those ones you put on your skin automatically, you don't need to pierce your nail. The CGM one, you put it on your skin, you can take a shower with it. Some of it lasts for 2 weeks, some of it lasts for 1 month. And then you program it on your phone. You say, okay, I want my sugar reading every 30 minutes. So every 30 minutes, as you program it on your phone, it's going to send your sugar reading to your phone. That is what your sugar reading is every 30 minutes, or depending how you program it. Is it every 1 hour or every 2 hours? It's going to send you the sugar reading. Or you say, please, when my sugar reading falls below this range, let me know. So it depends how you program the CGM. It's going to alert you, oh, your sugar level have dropped. This is the reading, try to boost it up. So everything depends on individual. Okay, so that is it. Where is the best place on your body to take blood to check your blood sugar reading? Okay, on your fingers, any of this? Okay, any of this? Okay. Normally I use this, because this and this and this is going to give you more blood. This also give you more blood, but this, to me, I don't know if here, to me, this and this give me more blood. When I put it, it give me more required blood. This also give it, you can use any of these fingers. All right. Then let's go to Yvonne says, can diabetes drink coffee? No milk, no sugar. Yes, you can drink coffee. Yes, including the tongue. Yes, you can drink coffee. No milk, no sugar, but you can only drink one coffee a day. Just 1 cup of coffee a day. You can't drink 2 cups of coffee a day. You can only drink 1 coffee a day. And no milk, no sugar. But one thing you have to understand is that that coffee also contains carbohydrate. You won't know that black coffee also, black coffee is a fruit. Okay, know that black coffee also contains some amount of carbohydrate. That is why you have to take 1 cup of coffee a day, no milk, no sugar. Okay, and then make sure the size of it, like this morning, I'm going to show you guys this. I did a coffee, and I said, okay, let me try soy milk. I put a soy milk on this coffee. Okay, I put a soy milk on this coffee. I just tested it just once. You see how big it is? This is what I just drink. Okay, I did a black coffee this morning, and I said, okay, let me test this soy milk. This is my first time. Let me just, experiment soy milk. And I just put a soy milk. And when I see that soy milk, I look at the reading on the soy milk. It says carbohydrate, 16 grams of carbohydrate in it. Protein, calorie has 5 grams of calorie. Then the sugar in it is 1 gram. Then I said, let me try on the coffee. Normally I take my coffee black. Then I mix it with the soy milk. Just a little bit. You see that just listen. You see this? Just this I just drink. My feet is on fire. As I'm talking to you guys now, my feet is on fire. As I'm talking to you now, my feet is on fire. So when I finish this program, I'm going to go to the gym and burn it off. Just a little bit of soy milk. Just little I drink. It's already, so you see that's what I'm trying to tell you guys. Yes, soy milk is good for diabetics, but that's 16 grams of carbohydrate. Just a little bit I drink, it's already burning me. So now it means my carbs have gone high. So I'm not going to eat any other thing again until I'm going to stay for the next 4 or 5 hours so I get this thing out of my system. So just a soy milk. So that's what I'm trying to tell you guys. No milk. Stay away from milk. Stay away from any kinds of milk, even almond milk. Stay away from it. I said, let me try it. Let me see this soy milk, how it's going to be. Just a little bit I drink this morning. My feet is already on fire. Okay, so soy milk, almond milk, I'm not going to even touch it anymore. I just stay away from it. So you can only drink coffee once a day. Remember that coffee contains carbs also in it. All right. Now, if I drink this coffee, if I had not put a soy milk on this, if I did not put any soy milk on this, if I drink my coffee, it doesn't do anything to me. I don't have any reaction. It doesn't spike up my sugar level. I don't have any, but because of the soy milk I put in it now, it's giving me hell on my feet. So I'm not going to try it anymore. So there are people, when they take coffee, even without milk or sugar, it still spike up their sugar level. And there are people that when they take it, it does not disturb them. Like me, it doesn't disturb me if I don't add anything in it. So it varies on individuals. So if you drink it and you start having a reaction in your feet, burning sensation in your feet, you stop it. Like now I know that soy milk is not good. And this one is wasted. I'm gonna throw that soy milk away now because I'm not gonna have it in my place anymore. Just a little bit of soy milk I put, I'm already having burning sensation in my feet. So that means the carb in there is too strong. Okay, the carb in there is too strong. So you can still take coffee, but even though without milk or sugar, know that black coffee also contains carbs in it. So you got to be very careful on the size, the quantity of the coffee you are taking, and then make sure that if you have any reaction, you stop it. Okay. So let's go. So now, what we were talking before, we were talking about your food cares. All right. Now, do you have any other question? My feet is on fire. My feet is on fire here, because of that soil milk I just put. So now, as I was saying about your food, checking your food is very important. If you're diabetics, checking your food is very, very important. Checking your food when you're taking your shower, wash your feet very well. I've seen people when they take their shower, they'll wash everything. But when it goes to their leg, they don't even touch it at all. They don't touch it at all. They're finished and they come out. You must wash your feet all the time. Clean it, and again, make sure you don't have a smelly foot. Anytime you start seeing that you start smelling your food smell. There are some people when they remove their leg from the shoe, you can't even be in the same room with that in them because that shoe smells a lot. So when your food starts experiencing smell, know that something is wrong. Okay, food care is very important. Check underneath your food to make sure there is no dot. Make sure there is no dot in that food. I'm going to look for another image. Share with you guys again. So this diabetic foot here, all right? You see how your nerves are damaged? Okay, this is your nerve damage here. See all this here? You see those white, okay? Those white areas are your nerve damage. Okay? Now, if you look at your blood vessels, those red ones are your blood vessels. Okay? Now, when your blood vessels are damaged, you see how wrinkled it is? It becomes wrinkled here. These are your wrinkles. You see, they are not straight. You can see the blood clot in between. There are blood clots in between in the blood vessels there. All right. So the nerve damage and the reduced blood flow there will cause you those problems. Okay. You have to make sure that yes, you can feel temperatures in your food. If you're not feeling anything in your food, there's a problem. All right. Now your ulcers is what you have to look out for. Ulcers always start at the bottom of your food. Food ulcers always start at the bottom of your food. So that is why you have to check underneath your food at all times. And it starts like a dot. It starts like a tiny red dot. Okay? It is not an open wound, but you can see a tiny red dot underneath your food. Once you notice it, start immediately to start controlling your sugar level before because it's going to be expanding a little bit, widening a little bit, and then the wound is going to open. But once you notice a tiny dot underneath your food, like red dot underneath your food, know that you are developing food ulcer. You have to do everything that's possible to start controlling your sugar level. Once you control your sugar constantly, it's going to stop it. It's going to start like a dot and then start expanding gradually, and then the wound is going to now open your skin. So that's why it is important you check your underneath your food at all times. Put a mirror on the floor, put your food, if you don't have anybody to check it for you. And also put your hands in between your toes to make sure there are no lacerations in between. Okay, and when you are cutting your nose, don't use razor, use clips and make sure you don't cut your skin. So all these things is what you have to know about diabetic food, because controlling your sugar level plays a vital role in making sure you avoid these complications. It is very, very important. You can see, see what I'm trying to say here. It starts like a tiny dot. Also start like a tiny dot. Once you see this thing coloration in your feet, then you're going to be wary. You got to be very careful, because that's how it starts, and then start expanding until it becomes like an open wound. This open wound here. So that is why you're going to be very careful. And then the next thing now is that the infection is going to start spreading to get to the bottom of where the nerves are. That is when you need an amputation. You see how it's going down? going down, because this is where your nerves are. This is your skin going through the layers. Instead of spreading this way, it goes down because it wants to get to the bone, to the nerves. Once it gets to the bottom of the nerves here, the infection is going to spread all over. And that is when you're going to look for an amputation. So this is how it works. It goes down. Instead of spreading vertically this way, it tries to get as fast as possible to the bone where the nerves are connected. So you got to check your feet at all times. Okay. All right. So let's get this in. Do you guys have any question? Do you have any question? Let me see a question here. All right. Nick, I have not. Alex, do you have any question? Alex, you have been away for a long time. So Nick is still here, and I didn't know that she's still here. I thought she's gone already. So yeah, we see. You are correct. My mother went through this ordeal, and unfortunately, her foot was amputated. She didn't survive it for long. Sorry to hear that. Sorry to hear that. Yeah, if you are living with diabetics, diabetes causes a lot of illnesses. Try as much as possible to avoid the complication. Try as much as possible to avoid the complication. All right? It is very important. As I said, diabetes is not the issue. Diabetes is just a word. Diabetes is not the issue. What diabetes is a disease, but it's not the issue. It's not what is diabetes is not what is not going to kill you. Diabetes is not what is going to kill you. What is going to kill you is the complications of diabetes. I've said it before. When people die of diabetes, you can never see them say, "Oh, this person died of diabetes." They'll write died due to complications of diabetes. That's what you're going to see in the death certificate. That this person passed away, died because of the complications of diabetes. So diabetes is not what is going to kill you. It's the complications that comes out of that diabetes that is what you're going to be scared of. All right. So that is why I said people that people are saying that, oh, about NAF. Is there any treatment for NAF? Is there, like now here, my feet are bothering me because of this soy milk I put in my coffee. Just a little bit of soy milk I put now, the carb shoot up now. So the question is, there is nothing like NAF medication that is going to cure it. Anything that has to do with diabetes has no cure, except we get a medication that can cure diabetes, cure it permanently, then it take care of all these complications. So when you're going through all this NAF, you want to learn how to manage it. Okay, there are medications that the one I share with you guys for it. There are medications, but those medications are for temporary relief. Okay, you're going to relieve the pain, those symptoms for a little while. But once again, your sugar level creeps up again, those sensations are going to come back. And you cannot depend on those medications at all times. So you don't want to build your body by taking medication. Anytime you have those burning sensations, start taking all those medications because you cannot allow your body to get used to those medications. So that means anytime you don't have those medications, you cannot survive it. So that is why the best thing is to control your sugar level and avoid those complications. Once you're able to control, that's what they're asking you to do, is can you please control your sugar level, and then all these illnesses, it's not going to happen. All right? So that's the only thing. It's like somebody saying, oh, I don't have an erection anymore. I say, yes. Why? The question I ask, why do you allow, why do you allow, who are you going to blame? I have to blame yourself. You cannot have an erection anymore. You have to blame yourself because You've been diabetes, been telling you to control your sugar level, you could refuse to. Maybe you say, oh, why, you just take it as know-how. Now, you see the complication now, you cannot blame diabetes. Now you don't have an erection because the nerves in those areas are damaged. And once they are damaged, there is nothing you can do. So I said, there's not I can. I'm being honest with you. I said, there's nothing you can do with your erection. It's damaged. It's gone forever. So what you have to do is you have to depend on Viagra, Cialis for the rest of your life if you want to have an erection. And Cialis, Viagra, and other medication is not a guarantee. You cannot be taking it all the time because if you have a heart issue, like if you have a heart issue, I cannot prescribe you Viagra or Cialis. So for me to prescribe you Viagra or Cialis, I have to make sure you don't have any heart problem. So if you have a heart problem and you have an erection problem, then you can't depend on those medications. That means you cannot have erection. That means you have to live your life that way with your wife or with your girlfriend. That's the secret. That's the honest truth. Then, so if I well, it's too late. That is why you have to control your sugar level. The same thing, amputation. Okay, if you control your sugar level, you won't have issues of this food problem, food disease, wound, or blisters. Because if you don't control it, it might damage those things areas. And when blood is not circulating in this area, and you happen to have any wound or food ulcers, and then you see that you were born with 2 foot, and now you are going to be living with 1 foot. Or if you're unlucky, it might be 2 foot. They're going to amputate those 2 foot at the same time to save your life. Okay, so everything has to do with controlling the sugar level, living a good lifestyle. If you know those things they ask you to stop eating it, and eat those things they are advised you to eat. Eating a healthy, balanced diet is one. Taking your medication as prescribed. Exercising is very important. Exercise is very important. Reducing your weight and reducing your stress levels. These are the key. Reducing your carb intake and increasing your fiber intake. These are the key to survive this chronic illness. It's as simple as ABCD. Okay, you can live with it for as long 30, 40 years. You can live with it, but you stick to this rule to have another life to live. Okay, so it's a simple rule. Avoid this, eat this for the rest of your life, and then you avoid the complications. It's not like diabetes. Say diabetes, when you have diabetes, say diabetes, oh, you have diabetes, you only have 2 years to live. No. At least diabetes has a treatment. It does not kill anyhow. It only kills when you are careless. When you don't take the medication, the treatment very serious. It only kills when you are not serious by yourself, when you are not disciplined, when you are careless, then it kills you. But as long as you stick to those rules, you are going to live a normal life. You're going to still have family, have children, live a normal life. So it's all about following the rules governing diabetes. As simple as ABCD. All right. Do you have any more question? Do we have any more question? Because we have to go now. All right, I'm going to let you guys go now. I have to go and watch my game. My game have started. All right. It's nice to see you guys once more. Yesterday, I was on the road coming back to my base. So it's nice to see you guys. No, you can't use insulin. Igwe Nena says, can you use insulin? Insulin cannot treat nerve pain. Insulin is to control your sugar level, to boost up your sugar level. Insulin has of 2 use. If you're an insulin dependent, it's either you have type 1 diabetics. Rarely, people in type 2 diabetes don't use insulin. In type 2 diabetes, it's either through medication, it's either through oral medications or dieting. It's only in rare occasion you see people in type 2 diabetes using insulin. Mostly, if you have type 2 diabetes, you don't depend on insulin. You only depend on dieting and medication. Insulin only applies on type 1 diabetes because they are insulin dependent. Because your sugar level is fluctuating all the time. Now, you use insulin to boost up your sugar level in type 1 diabetics. In type 2 diabetics, you are struggling to bring down your sugar level to the normal range. Type 2 diabetics have to deal with higher sugar level. So what you are struggling is to bring it down to where it's supposed to be so that it doesn't have any bad effect in your life. While type 1 diabetes, you are dealing with all the time your sugar level is going down below the threshold. And those threshold is dangerous to your life. So you need insulin to boost it up to where it's supposed to be. Now, that is where you become insulin dependent. But we don't use insulin in treating nerve damage. No. But if you're talking about insulin to control your sugar level, yes. If you are dealing with type 1 diabetes, remember it's an autoimmune disease. But you don't use it, say, okay, I'm having a nerve damage. What can I use to treat nerve damage? You don't use insulin for it. Insulin is specifically used to control your sugar level if you are type 1 diabetics. Type 2 diabetes, you depend on oral medications and dieting and lifestyle changes to manage it. Now, as I was saying earlier on, okay, there are thousands and thousands of medications for treating nerve pain, okay, but there is no cure for peripheral neuropathy, those diabetic nerve pain. There is no cure. As a result, it's due to complications of diabetes. The only way for you to get a cure for those symptoms of nerve damage is by having a cure for diabetics. So, but there are medications you can use to treat nerve pain, okay? But these are only temporarily. You can only use them temporarily to control those nerve pain. But once again, once your sugar level goes high again, those symptoms returns, okay? So that is it. Do you guys have any other question? All right. Even Nena, this is the first time to see you here. You're welcome. You are welcome. Yeah, Neka, I know. Once you hear I want to go, you are the first to say want to. Okay, go. Happy. See you next time. Okay, thanks. Neka, go. They are waiting for you. Go. I don't want you to get a black eye because of me. Go and attend to your family. All right. Do you guys have any other question? Brian, do you have any other question? Okay. Yvonne, do you have any other question? Alex, you're silent. Marilyn, I didn't hear from you. Diane, Ruth, I didn't hear from you. Chembo, Beverly, you guys are gone. All right. Okay. All right. Okay. So in the absence of any other questions, I'm going to let you guys go now to enjoy your Sunday afternoon or Sunday evening or morning, depending where you're watching from. I'm going to be posting some videos later on. Okay. So you guys can keep watching. If you have any other questions, you can send it across. Anyone that has any other question can send them across and I'll respond back later. All right. Except if you guys have any question now, then all right, you're going. See you. Thank you very much. So I'm going to let you guys go to enjoy your Sunday afternoon or evening, and then we shall meet again this week. All right. So in the meantime, I'm going to say bye-bye to you guys. All right. Yep. Okay. So have a wonderful afternoon, evening. All right. I'm going to see you guys more this week. Within this week, I'm going to be live again, and then we can take it up from there. Okay.